আমার অনেস্টলি আমি বলছি ইচ্ছা নেই। এখন 12:45, তো 45 অব্দি ডক্টর শামিকা রবি বলে 45 মিনিট
Good afternoon, everyone, and thank you for being here. Our speaker today is Professor Shamika Ravi. She's a senior fellow of the Governance Studies program at Brookings, at the Brookings Institute. Formerly the Director of Research at Brookings India and leader of the Development Economics vertical, her focus is on issues of developmental economics, such as gender inequality, financial inclusion, urbanization, and health. She's also an assistant professor of economics at the Indian School of Business, where she teaches courses in game theory and microfinance. And she was a member of the Economic Advisory Council to the Prime Minister of India. It's an honor to have you here today with us, ma'am.
Thank you, Tia. And hello, students. Hello, dear teachers. You know, as we all work from home and study from home, I think we must spare a thought to our ancestors about 100 years back when they were doing exactly the same without any access to technology and communication anywhere close to what we have today. So we also have to count our blessings and make do with what we have. But thank you so much for this opportunity. I'm so glad to be here with you today. I have put together a little bit of statistics. Economists generally tend to look at the world, mostly empiricists, through data. So what I want to familiarize you with is what this pandemic means for India and what exactly does it mean for individuals in particular. So now I hope this is visible to everyone.
Yes, ma'am.
It is. Okay, great. All right. So basically the topic I was asked to speak on to you was the economic and social impacts of this pandemic. It's still an unfolding problem, folks. So I think we should also be a little modest in sort of acknowledging the fact that this is still largely an unknown beast. The true nature of this pandemic will only become clear as time goes on. So we are 6 months into this global pandemic, and let's see where we are today. But it's still an unfolding problem, particularly from the health side. It remains quite uncertain, despite the fact that there is a global race for the creation of vaccine. We have never seen this kind of global network come together, despite the growing fear in terms of growing numbers. I wanted to show you just a basic status update to first of all assuage your fears that perhaps this virus isn't quite as deadly as it's made out to be. Of course, we're all working from our homes and isolated in our own endeavors. But the truth of the matter is that while India has a little under 16 lakh total cases today, and it's almost become like a scorecard that we watch every morning and evening, the truth is that a very large number of people will also recover, and they are recovering. So if you look at the current recovery rate, India has about almost 65% of all our cases are people who have actually recovered from the virus. And this number is only going to go up. As of now, we have about 33% active case. Now, you know why active cases matter? Because it's truly the demand that is being placed on the healthcare infrastructure today. That even if 10% of this 5.5 lakh active cases require hospitalization, it is still a tremendous burden on our already, a modest and weak healthcare infrastructure, particularly if you think of rural areas, smaller towns, etc. But this is how it looks. Now that growing red segment is also telling you that we are seeing more deaths. But we have about a death rate above 2.2%. So we have 35,000 odd lives that have been lost to COVID. Now, how fatal is this? Well, globally, we are seeing that the case fatality rate is indeed declining, and it is declining just as sharply in India. So as of now, we are seeing that out of every 100 people who catch this virus, lesser and lesser, fewer people are actually succumbing to it. And this is, again, good news. Now, it could mean that we know what has to be done. The treatment protocols are getting developed. We have a better understanding of which way this virus is headed. But all in all, more knowledge is leading. And of course, remember, people are also taking a lot of precautions. So we must give credit to every segment of society in minimizing this case fatality rate. Now, while we sit in India and we are, of course, concerned about what is happening in our own country, we must realize that, on an average, we are losing around 26 people to a million population. Now, compare that to, let's say, a country like Belgium or UK, where they are losing on an average 860 people, or the UK, which is almost 700 people. So these are countries far more advanced with much better infrastructure. And yet they are seeing a very high death rate. Now, the causes are still to be deciphered, but clearly the older population are more susceptible. And you're seeing that the death rates in many of these Western European countries, and including the US, are multiple, almost 20, 25 times as much as what we are seeing in India. It perhaps might be India's young population. It might be innate immunity. It might be just the fact that people are exposed to all kinds of viruses, and that gives them some degree of immunity to this category of virus. But these are all unfolding hypotheses, kids. We really need to wait for the science to emerge. But what we are observing is we are losing fewer people compared to most developed parts of the world. Now, you must have heard this in the newspaper, that when serological surveys are being done, which means, of course, when people have symptoms and they get tested, we know that they are indeed infected. But before that happens, and just to get a broad sense of how common is this virus, serological surveys are being conducted across big cities. And these have been done in many cities in the US. They have been done in Western Europe. In India, more recently, just 2 days back, we saw the results from Bombay. We have seen a few weeks back the results from Delhi. And all these surveys are telling us that a very large fraction of the population in these cities actually have developed antibodies to counter a virus like COVID-2, right? So that tells you, which are the two basic implications at the bottom, that this infection is therefore far more common, and it is hence far less deadly and fatal than what we are, we're trying to say from the day-to-day number watching. all right? So the day-to-day numbers are only a small indication of what the true nature of this virus is. So that's a good thing. And second is that COVID-19 in India is far less fatal than it is in Europe and in the US. Now, why do I tell you about these two regions in particular, and not so much about Africa and Latin America, where the virus is right now raging? Well, I'm telling you this because this is what media discusses in India. In India, when we discuss economy, when we discuss healthcare, current affairs, geopolitics, there is a blind spot to the rest of the world. And we tend to think in terms of a highly developed economy. So mentally, we are a developed, a rich country. But the reality of India is that we are truly a low middle income country. And that reality mustn't escape you when you try and understand what the situation of healthcare and the economy is. All right. Now, we are in the midst of massive pandemic, and we have seen extended lockdowns. In fact, we have seen 4 months of lockdowns. Now, as an economist and a health economist, of course, while I do realize, as perhaps all of you do, that a lockdown does stop the transmission of the disease, right? Because physical distancing is mandatory. You have to stay in your houses. While it is good for the spread of the infection because it limits it, it stops it, it is quite detrimental in terms of the economy itself. And to all of you who have studied economics or who are studying economics, you know, the one concept which will, or one understanding which will, I think, separate you from the rest of the students and people at large will be this understanding of opportunity cost. That it's not just how much is something costing you in terms of actual money and accounting cost, but what is the counterfactual, right? So the opportunity cost of being locked down or for an economy to be shut down is how much money we are truly losing by not functioning, right? And that opportunity cost in our economy is particularly severe, right? So now yesterday we got the numbers for the US economy, and we do know that in the second quarter they have shrunk 10%. But these are rich economies, right? These are very rich economies, and they do have the wherewithal to weather this kind of an economic downturn. But for us, it translates into millions of workers losing jobs. And given the nature of the banking sector, now think of anyone who runs a small business. Because people are not buying right now, there's no revenue. And if there is no revenue, how am I going to pay off my loans? And if I don't pay off my loans, the banks, which are anyway struggling with non-performing assets, and they're struggling with health of their own portfolio, are going to weaken further. So the economy truly is this mammoth, complex, composite structure, which is going to feed off each other in this downturn. So the role of policy then becomes one where we can break this cycle, right? We do know that till a vaccine is therefore commonly available to everyone, and I must, without sounding alarmist, we have to recognize that, look, even if the vaccine is ready in, let's say, 3 months, because the third stage trials are happening, by the time it is mass produced and available to everyone, it will easily be a year and a half to 2 years. Until that happens, we will continue to see resurgence of the infection. As we are seeing in Japan, we are seeing in Spain and France. Now, those are rich countries with tremendous government capacities and very good healthcare structure. So if those countries you're seeing resurgence, naturally, we are also going to see resurgence in our country, all right? So we are therefore saying now, perhaps instead of massive lockdowns, we really need to lock or isolate in more precise manner. So put away, isolate people, colonies, districts, schools, where you have cases. So, right, so you should also think about what will happen to the future of schools. Now, schools, this virus tends to spread when you have closed door interaction of people, when there is loud speaking, because aerosols are a common source of infection. That's why markets, when you look at churches, when you look at all congregations, and schools are exactly that. It's a highly social activity that schooling involves. So that uncertainty is going to impact your lives for the next several months. And therefore, containment, isolation, and testing has to become a normal part of our lives. So we have to start treating it more like a TB. right? Because we have been following exactly those kinds of protocols in the past. So wear your masks, maintain physical distancing, hand hygiene. We can't emphasize enough the need for this kind of interventions. Now, one quick remark, because I think we tend to separate health and economy. And since this is Laissez Faire, and you're all budding economists, even if you don't get into economist as a profession of doing research and sort of propagating the literature through training, you will be using tools of economics in your day-to-day life, all of you, right? It's important to recognize that poor health care is going to feed off and generate. So it's a highly endogenous, these are intertwined with the economy. You cannot have economic growth with poor health. And similarly, improvement in health requires the economy to grow. So the two things go hand in hand. Now, of course, under COVID, there is great alarm and everyone is concerned. But, India, we've been living with infectious diseases for a long time. In fact, I just gave you the number for COVID, 35,000 deaths until now. Of course, this will continue to keep surging as the infection grows to other cities, but compare it with tuberculosis. We lose annually 4 lakh people to TB. That should give you a perspective on what is the reality of India's healthcare, which is why having labs, diagnostic labs, testing labs in every block of the country. India has 7,000 blocks. We should have testing labs everywhere. Every district hospital should have an infectious disease ward so that people have access to this kind of care. And clearly, because we spend so little money, and even from the government's perspective, nobody really wants to work in the health ministry. If given a chance, I would much rather be in finance or much rather be in some of the cooler parts of the portfolio. That is the normal thinking, even within the government, right? And of course, on the private sector part, we do know that healthcare is an excellent industry. It's been doing really well. India is emerging as a hotspot. And I don't mean from the COVID side, I mean from healthcare industry. Health tourism is booming. So while the private sector is expanding, from the public side of service delivery and policies, we have to do a lot more. Close to 7% of our citizens fall below poverty line because of healthcare expenditure. So imagine that is the reality of the poor and the weak, very modest healthcare infrastructure that we grapple with. Now, I think a reality check needs to happen, and I'm hoping it is happening now, or it will happen because of this pandemic. No country in this world, students, have ever grown without making significant investment in health and education. And if we continue with this degree of investment, which is very, very low, economic growth cannot become self-sustaining and the kind we are hoping to get out of this low middle income trap. We really have to grow, because $2,100 a year is not that much money, frankly, and it's not going to pull more people out of poverty. Now, here is a very cool, quick graph, because I know a lot of you are interested in animation. 50 years back, not that long, many of your parents will have read about this. 50 years back, South Korea, China, and India had the same per capita income, meaning an average citizen of South Korea, China, and India were identical in terms of living standards. And today, South Korea is 10 times as rich as us, and China is 4 times as rich as us. Now, that wealth creation requires investment in health and education. Okay, growth is a real time, it's a real phenomenon. It's not an abstract concept. So we need to make these investments, just like the Chinese did, just like the South Koreans did. The reason I talk about these examples is because, they were close to us, they are similar to us, and they did certain things right in order to become global leaders today. And of course, I'm not comparing with Europe and US, etc., which have had very different conditions. Now, many things have happened, excellent things have happened to the Indian economy as well. Because we had sustained period of 15 years of growth, you saw infant mortality, which is a very basic metric of quality of life. Infant mortality in India has crashed in the 15, 16 years of growth. And this is not just happening in the southern part of the country. Mm-hmm. This is happening also with some of our weakest and states with the poorest health infrastructure, UP, Bihar, MP, Rajasthan. Just look at it. infant mortality declines when you have growth. And that's because it's not necessarily because of government. Government is a very, it's one part of it. It's because when there is more wealth in the economy, there are better connectivity, better roads, better healthcare, there's more food, there's cleaner water. And because of all of these things, you will see quality of life as measured in terms of infant mortality. It improves. Now, the second part of the story, and because you're all going to be either entering the higher education, most of you will, but you will also be very concerned about the actual skills that you possess, right? So because you're going to enter the job market in the next few years, I want to tell you something which is peculiar to India. It's peculiar to us, and a little bit from the Chinese as well, but particularly in India, which is that, in the age group of 18 to 29, who are called the youth of a country, not students, but the youth, unemployment is 5 times more, it's higher amongst people who have a graduate degree and above. Which means when you get higher education, when you have at least a graduate degree, you are likely to report 5 times higher unemployment rate. Now, this is not normal, because globally and historically, we know that when you get more education, the chances that you will get employed are higher, because education does lead to jobs and prosperity and so on. But what is happening in India, that this concept of graduate unemployment is becoming more and more severe. Why are more educated youth so much more likely to be unemployed compared to relatively uneducated people with primary education and below? And that's a basic indication of, one, do not mistake a degree or a certification for actual skill. We are producing lots and lots of graduates, giving them degrees, rewarding them certification, but the actual skill set that they join the labor market with are not that great, which means the companies or the actual demand for the skills, what is it that you can truly do and how productive you are, will determine whether you get that job, right? That's one side of the story. So don't mistake degree for skill. Do work hard and get real skills. And I think that's where all of you belong to such excellent schools. You already had a leg up. And it's important for you to keep investing in your own skill set. So continue to learn real skills, all right? But the second side of the story is also managing your expectations. And that's why I said we think like OECD or rich countries. But the reality is that India is still very much an emerging market. So people tend to continue waiting for longer time for the ideal job, right? So is that a bad thing? Well, other than the fact that you are a productive resource sitting at home, which is not a good thing, the alternate way to look at it is that we can afford to sit at home now because we aren't that poor. So this is a natural phase in the growth of economies. But in India, this has become quite severe. And I think as students entering that phase of life, it's important for you to understand why skills are important. But this is the last statistics I want to leave you with. Yes, we are in the midst of a pandemic. Yes, we are a low middle income country. Our growth is looking slow and weak. We are undergoing a lot of structural reforms, yet to see what implications of that will be. But don't forget that in the history of mankind, no country other than India and China have brought out hundreds of millions of people out of poverty ever, right? And that is truly a remarkable achievement. Now, in the Indian case, it still remains a work in progress. Though, if you look at absolute number of poor, we have less than 25 million now. And that is a remarkable achievement. In fact, today, smaller countries like Nigeria and Congo have more number of poor, measured by the World Bank's $1 a day poverty line. So this is something you should be proud of. I'm definitely proud of it. So growth gets us a lot. Growth gets us better health. And it does pull people out of poverty. And that's why growth is important. I want to end with that. Happy to take questions. Thank you and good luck.
Thank you, ma'am, for that wonderful presentation. So as you know, we're going on to the question answer session. So our first question is, how do you advise we adjust with the new normal so that we can see a progressive economy in the future?
I think the new normal is also an evolving normal. The good thing is that we do have access to communication technology, which we've never really historically had, and making use of that technology to stay connected. First of all, again, from the health perspective, remember mental health. Depression is a very leading cause of, leading morbidity in India. In fact, it is one of the top three. Mental health is one of the top three ailments most common in India. So remaining in touch, trying to live as normal a life is very important. And that's why I think you're all very lucky. You have, I think, I have taught in many countries. You have perhaps some of the most hardworking teachers I have ever seen. So just, and remember, technology adoption is a lot easier for you guys than it is for many of the teachers. It is definitely more difficult for me now. And with age, it just becomes more difficult. So I think trying to remain in touch, take care of mental health, stay connected with your friends, your family, but also use this time to read, use this time to educate yourselves with possibly even newer skills. I think this time, consider it a bit of a downtime as well for introspection, enjoy the bluer skies. So yeah.
Okay, thank you for that answer. So the next question is, do you think the new education policies will help the Indian population be more skillful and employable?
The new education policy, frankly, this is the new education policy, which tells you that this has been a long-term process of refinement. So it has taken a very large, long, consultative movement to really put this document together, this policy. Now, one thing is, and that is why I put this last, the slide about the graduate unemployment, because I do want you guys to recognize that education is not just about a degree or a certification. It is not just a case of signaling to the market that, look, you have had 16 years of education or 12 plus 4 and so on. It requires actual skills. And I think that is where the new education policy is trying to design an architecture in India for education, where we can truly compete with rising economic powers like China and others, which means you are going to now have an education system which caters to core skills of students. That is very, very important. And of course, the higher education part of it is also very important, because we haven't spent much on R&D till now, so we don't do that much research. And as global leaders and aspiring global leaders, I think the new education policy puts enough emphasis on bringing research back into higher education and training.
Okay. So the next question is, once the vaccine is out, what should be the order of preference for distribution? Because there's going to be like a low supply.
This is such a difficult ethical question. And we have all seen it, these countries having to make such ethical decisions, even when the pandemic broke. Remember in Italy, when suddenly in Lombardy region, when they had a massive surge, they had to decide, whom do you give the ventilators to? Whom do you give the beds to? Should you give it to the young, who are more productive and they have more years of life? Or do you give it to the old, who are actually more needy because they're more vulnerable? Now, these kind of ethical questions have to be answered, or they have to be, resolved within the community. I don't think this will be a very easy decision. The good thing about large federal country like India is that because health is a state subject, I think overall, while the mandate will be to make vaccine available to all, I think different states and therefore different communities, you have to break it down to highly, disaggregated local level decisions. I think these decisions the final implementation, I think, will be decided at the local level.
So the next question is from Sana Sharma of Vasanari School. Do you think universal healthcare is a viable option for India? And if so, do you think everyone will comply?
I think universal healthcare, Tia, is not just viable, it's a necessity for an emerging global giant as India, right? And the reason is that, out of every 1 rupee that India spends on healthcare, and when I say India, it means all of us, 63 paisa out of that 1 rupee is spent from a citizen's pocket, which is called the out-of-pocket health burden. It's very high. A place like China, it's about 20 paisa. Thailand is about 11 paisa. Now, it just tells you that, countries which are not remarkably, I'm not talking about Europe. It's China and Thailand, countries which are part of the emerging markets. Even they have designed healthcare financing methods and policies where the burden on citizens can be reduced. So universal healthcare is a necessity for a country like India, because without human capital, you can't grow. No country can grow without human capital.
Okay, next is from Vedika. Where do you think the government should prioritize investing right now?
You mean economic investments?
Yes.
Okay. Well, human capital. I think given the underinvestment into health and education, India has to invest more in health and education. That's number one. Number two, and remember, I think the problem is that typically, up until now, we have had, we consider health, education, and gender, I think, which are all fundamental components of human capital. Health and education and gender, they're treated as social sector. I don't know what social sector means, because we all live in the society, right? I mean, of course, you don't live in an economy, you live in the society. So poor health and education impacts all of us. It's as fundamental to economy as actual livelihood of people, right? So don't separate the two. I think it's very important for Indian thinkers and Indian policymakers to treat human capital as fundamental economic decisions, right? To improve productivity of people. When you guys are smarter, you're educated, you're healthy, that's when growth is going to happen, right? So human capital, very important. I think beyond that, infrastructure remains a big bet. I think in terms of capital expenditure, we still have many parts of the country where, despite gains of last 25, 30 years, where I think the infrastructure remains an impediment. So there is also from the supply side. But remember, from the jobs perspective, infrastructure, construction, these are very big job creators. So that's another reason why we must double down at a time like this on infrastructure development.
Okay. So earlier today, we had a talk by Mr. Sainath, and he talked a lot about the migrant labor. So what do you think the new normal will be for the labor market in terms of wages? Like, will they have it better or worse?
I think it is, again, still an evolving question. One point of view I have is, first of all, again, the reality of India's liberal democracy. We are a large federal country where when Delhi and Maharashtra, people move from these large economic centers, and particularly the Western corridor, all the way from Gujarat, Maharashtra, Tamil Nadu, these are, highly industrial parts of our country. Most of the migrants have come from the eastern states, which are rural, underdeveloped, and so on. When people want to go back for fear, or maybe there were push factors, maybe there were conditions in Delhi, Bombay, etc., which were not very conducive to keeping these people back, right? When people want to go back home, they go back home. We are not China. So the kind of containment countries like China have seen within this COVID pandemic, it's unlikely that a liberal democracy like India can impose. That's number one. And it's very important that you realize the reality of Indian democracy, right? So containment, it would have been nice if we said, no, you can't move, because if you move, the infection goes with you. You can't do that, right? That's number one. Number two, a survey done by NCAER, which is one of our leading applied economics think tank, it showed that the people who have gone back, first of all, are a small fraction of overall migrants who come into these areas. But the people who have gone back are mostly seasonal migrants. So these are folks who come for 3 months, 4 months, and then they go back, right? So it's these folks who went back. That's number two. Number three, it's not like the states of UP, Bihar, Jharkhand will just sit idle either, right? The onus is very much on them, and we are very happy to see that some states are taking initiative in terms of bringing about labor market reforms, in terms of providing jobs for citizens back at home, right? The fourth factor is eventually at the end of the day, we do have social protection in the form of, which is one of our most progressive schemes, the NREGA. So people will demand and they will get the minimum number of days of employment under NREGA. The spending in NREGA has been increased. So multiple factors are coming into play. But we also know the reality isn't quite as neat as saying 4 points. Many people want to come back to Bombay and Gujarat, right, in Maharashtra and Tamil Nadu, which means that, look, as the factories begin to function at higher capacity, they need the workers. Local workers in these areas are very expensive. So finally, you will see large number of people from UP, Bihar, Jharkhand go back to Maharashtra, Tamil Nadu. And that's all good. We just need good, timely policy intervention so that we don't have starvation death. It does not turn into a humanitarian crisis. But eventual movement of people across the country, I think, will happen sooner than what I think people have predicted.
Okay, thank you. Again, drawing from Mr. Sainath's talk. So how come various governments never thought about like the welfare of labor? It's very in our face right now, like because of the crisis. But previously, governments haven't really thought about it.
Well, that's not true, is it? In a democracy, how can you not think of labor? Right? That is the reason I think I showed you the last graph, which is that along with growth in India over the last 20 years in particular, we have seen a massive reduction in poverty. And the reduction in poverty is not for you and me, right? We have been fortunate to be well above the poverty line. We shouldn't forget that. A lot of people who have been pulled out of poverty in the last 25 years have been in the casual labor, contracted labor category, right? Now, the government has not had concerted policies for labor in the form of, let's say, the construction workers, the package that was announced. Yes, those kind of policies, high time a country like India designs. Like we have NREGA, we have PM Kisan for farmers. We have to have similar social safety net for labor as well. It's very, very important. But the reality isn't that no one has scared. A lot of the outcome of growth of last 25 years have been in the form of reduction of poverty, which has catered to this segment of labor market in particular. So it's not all bad. We do have a good side to the story as well.
Okay, thank you. So the next question is, do you think we should adopt something like UBI to help people sustain during this crisis?
So for those of you who are interested in UBI, I wrote an article in the Foreign Affairs about 3 years back on why India is ready for UBI. And that was more from the point of view of, look, it's very costly to target people and give them subsidies, because targeting means you most often end up giving it to the wrong people. There's just so much corruption down the chain that eventually it's very costly to target, right? So UBI is a good policy from that perspective. The reality of the matter, again, of India's democracy and the kind of plural and liberal democracy we have is, imagine a UBI in reality. How would people react if you started cutting checks to, the big billionaires, the ever-increasing list of billionaires in India? It's just not politically a good decision. So we will never have true UBI, which is universal basic income. What we will have is still targeted in some fashion. And so PM Kisan, what we do have, which does give a directed cash transfers to farmers. We now have construction workers direct benefit transfer. We do have similar policies for different segments of the market, which are more vulnerable. But a universal basic income of the type, which is theoretically how economists tend to think of it, I don't think it's going to work in India, just given the nature of the politics. That's number one. Number two, from an economist perspective, right now, if we put cash in everybody's pocket, will it overnight translate into demand? Will they go out and buy? No. Because the current uncertainty and the fear in the market, and by market, I mean just us, we're not buying all that much, right? I mean, we're buying essential items, but we're not going shopping. We're not buying apparels, shoes, many things, definitely not traveling. So, even if cash was given to everyone, it's not going to translate into demand in the market. People will save it. And that is called precautionary saving. And that is what happens when we are fearful and the environment is uncertain. We will save, not spend. So then a UBI, even theoretically, is not a good idea at a point of time like this.
Okay, thank you. So the next question is, even a developed country like the US has succumbed to the COVID-19 pandemic. So how can we avoid facing such a situation again?
We have to invest in health, Tia. There's no alternative. There is absolutely no alternative to investing in healthcare. And by healthcare, I'm not just saying more beds and doctors. Of course, those are very, very important. But we need an entire, overhaul. Imagine, and it's not even just funding. I want you to appreciate the fact that a lot of our states are sitting with underused health budgets, meaning the money is sitting. It's lack of ideas, number one. It's lack of priority. I think that is very important. Number two, but also very importantly, you need an entire architecture. We need health data being put together. We need the markets to work closely with the government. 75% of India's healthcare is private, right? So private players are a very large part of India's healthcare. And yet we don't really have proper regulations yet. That's why you hear all these stories in the media about medical negligence, and it becomes highly sensational. But the reality is that we have not given healthcare the kind of priority that an emerging economy like India ought to give, right? So we should invest more money, yes, but along with more money, it should also be jointly done with overhauling the governance structure. Because I know that doubling the health spending in UP and Bihar is not going to improve outcomes overnight, because those states just lack the government capacity in the healthcare space to use that money appropriately, right? So we need to prioritize health so that we are better prepared next time.
I'd like to thank Professor Shamika Ravi for coming here today. We have learned a lot from her. We cannot have economic growth with poor health, and improvement in health requires economic growth. I'm sure this has been an enriching experience for all of us here today. I'm sure everyone is awaiting the results, and so I now request Ms. Puri to declare them. We're facing some technical issues. It would be great if you could bear with us for just a couple of minutes.
ये हो अगले मुफासा Mehul.
So Dr. Ravi, thank you so much. This was such a lovely talk. I think we are expecting Mrs. Puri to join in anytime, but it's a very interesting entire day's program that we've had. First, the talk from Dr. Sainath, and then all the programs that the children were a part of, which was including the quiz and the synergy. And I think it's been a very, very educative day. This is the first time we've done Laissez Faire online, and we'll just wait for a few more minutes and just wait for Mrs. Puri to join in. If there are any other questions, then we should go ahead with those questions. Anyone has a question to ask? I will ask you a question which has been in my mind. While you did speak of China and of Korea as countries which have done very well, which they have, but it has been at the cost of liberal democracy. Sometimes I wonder if the cost isn't it worthwhile the way we have done it? I know it's slow, and I know, but I'm also this hardened person who always tries to look at the positive side. But to an extent, I'm sure we could have done it better. But isn't the political system and the freedom and the rights that we all enjoy has been to an extent worth the fallouts? Dr. Ravi.
Ma'am, I think she's left the meeting.
Okay, so then we'll just wait for a few more minutes, and we'll wait for Mrs. Puri to join. I think she was expecting to join at 1:30, and we are a little early. Oh, it is 1:30. So she will be joining in soon, and then we can
I'm
announce.
already there.
Okay, wonderful, Mrs. Puri.
And I've been watching, I've been dipping in and out of all the events and been so impressed with how clever the children are. Really.
Yeah, truly.
So shall we just announce the results now?
Yes, please.
Okay, so this is how the results have come. Mrs. Mitra and Ms. Krishnan have sent us. But first I have to tell you, not because it's our school, Vasant Valley, but Vasant Valley kids, you've conducted the show, the event really well. So congratulations for that. And a big applause for that also. And all the other students, everybody is so clever. Mrs. Bakshi, I am so amazed at how clever everybody is. I feel and look like a fool in front of all of them. But anyway, now I will announce the results like I've got. So for Biz Bash, the first prize is Vasant Valley School. The second prize is Sri Ram School, Malsari. Congratulations to both. Results of the social science quiz. First prize is Sanskriti School, Ishan Kanodia. Second prize is Sri Ram School, Malsari, Adyan Shukla. So congratulations again. Synergy team that came first was Avya from Mayo Girls. Am I saying it correctly? Avya,
No, ma'am, it's Avyana.
Avyana. Okay, I'm sorry. No, is it Avyana from Mayo Girls?
Yes, ma'am.
Okay, so Avyana, sorry, I'm really sorry. Avyana from Mayo Girls. Maria Javed from Modern School. Mehika Sikhin from Vasant Valley School. Saisha Saxena from Cathedral School. And Ananya Iyer from Mothers International School. Congratulations to all you bright, brilliant, wonderful kids. Then economics online, the first place is Mothers International School. Second is a joint prize for Cathedral and Vasant Valley School. So congratulations. And the overall winner of the fair is also a joint first, which is Sri Ram and Vasant Valley School. Sri Ram Malsari and Vasant Valley School. So a big congratulations to everyone. And thank you for organizing this really, really wonderful event. And the online event, I have to admit, is much better than the physical event. Maybe because it's very new, and also maybe because we are organizing it very well and everybody is participating and very enthusiastic about this online. So everybody is putting their best foot forward and it's really enjoyable. So thank you. Thank you, Mrs. Bakshi.
Thank you so much, Mrs. Puri. And thank you everyone, all the organizers, the teachers, the students who've worked so hard. And it's really been a fabulous morning. And I'm sure we all have really enjoyed it and learned so much from it. Thank you, everyone.
Thank you. Bye-bye.
Next year, we'll see you physically in school.
And maybe online too.
And yes, maybe in the online version too.
Well, it's double work for all our teachers, but you know, our teachers are so good. They will agree to do it. And I think we should have both. So thank you very much.
Let's give a huge round of applause for all the participants who showcased such wonderful work today. I'd like to thank everyone for participating in this Laissez Faire today. I now request the winners to stay back for a few minutes and the others may. I request the participants to rename themselves to the event they were part of, so it will be easier for us to divide you into breakout rooms.
Vedika, we can't rename right now. We haven't been given access.
Mrs. Kapoor, just may give them access to rename themselves. Now you can rename yourself so that I can quickly put you in the breakout rooms.
And sorry, can you please repeat what we have to name ourselves as?
Rename yourself as the event you participated in, the one you won.
For example, if you were part of Eco Online, then you just rename yourself to that. Or if you were part of Biz Bash, then rename yourself to Biz Bash.
So the quiz participants haven't still renamed themselves.
We only need the first place winners for the breakout rooms. The rest can leave.
What happened? It's taking
Arshita?
long.
Ashita, can you switch off the live streaming?
So now we're done.